Hello, and welcome to the 9th of our Growing Care Farming monthly themed webinars. This webinar is going to tell us more about how care farms can support people with dementia, and also about some work that's already taken place between the charity Dementia Adventure and Scrubditch Care Farm. So just a few brief housekeeping points before we start. This webinar is being recorded and will be uploaded to the Socialforms and Gardens website in due course, so you can go back and revisit anything that you feel that you've missed. Your details and attendance are private and won't be shared. Attendees are not visible via video link and you're all automatically muted. But any questions that you've got can be asked through the questions function in the menu. You can type your question and one of the team is going to pick it up and ask it on your behalf, or if you wish, we can unmute you once the recording's finished to ask your question at the end. Any links in the presentation we'll paste into the chat function to enable attendees to click on those and view the information during the webinar. So at the moment, you should be able to see 4 faces on your screens. I'm Deborah Evans, the Regional Care Farming Manager for Growing Care Farming. I'd like to introduce Kath Pyke, who is Project Coordinator for Dementia Adventure. Hi, Kath. And Gerry Fouracres, who is the manager of Scrubditch Care Farm in Gloucestershire. Hi, Gerry. You can also currently see Katie Jeffries, who is our project officer. She's going to be monitoring the questions during the webinar, and she'll lead on the Q&A at the end of the session. And she'll also be monitoring anything that get put into the chat box. So do please feel free to post any questions that you want as we go along, and then we'll pick them up with Kath and Gerry when they've finished their presentations. And you have got the option to post your questions either publicly or privately. Kate is going to turn her camera off shortly, just so as not to distract, but you'll be able to see me and Gerry and Kath all the way through. So we've worked very closely with Dementia Adventure over the last 10 years, starting originally with a research collaboration and then helping to support the work that Kath's going to talk about today. So it's really, really nice to be able to bring both Kath and Gerry together to hear from them both today. So I'm going to hand over to Kath to start with, and she's going to tell us a bit more about Dementia Adventure and some of the great work they've done with care farms, including Scrubditch. And then Kath will hand over to Gerry to talk in a bit more detail about what they've done in practice to support people at Scrubditch. So over to you, Kath.
Thanks, Debbie, and thanks so much for inviting me here today. It's a real pleasure to be here today, so thank you. And yeah, I don't know about anybody else, it's absolutely sleeting outside my window and has been all day, so I don't know if some of you have got snow who are listening in today. But thank you for those who are joining us today and are interested in this. Because, you know, talking about people with dementia, although there are lunch clubs and support groups for people, there's not that many of those, and most of those are indoors. So there's very, very few opportunities for people to get outdoors in supported situations. So fantastic that you're here and thinking and planning and hopefully planning to do something like that. And right now with COVID, you know, people have spent so much time indoors, and when we can get out again as a group as such, it is a safer place to be. And again, if you're planning things, people are much more receptive and open at the moment, I think, to the health and wellbeing benefits. So perhaps that's in your favour too if you're just starting up. So as Debbie said, Gerry and I are doing a bit of a double approach today, and I'm going to be looking at some sort of benefits and considerations, a bit of an overview. And then Gerry's going to come in with a real practical perspective, which is probably what you really want to hear about. And, you know, but we've worked with Gerry on our project for over 2 to 3 years, which we're going to talk about now. And, you know, her farm went from no provision in terms of supporting people with dementia to a weekly programme since 2018, which is up and running now, which is absolutely fantastic. So really glad that we're both on here today. Yeah, just a taster today, and if we can't get everything onto the chat view in terms of what I cover, then we're going to send out an information sheet as well, so look out for that in the follow-up email today. Right, so on to Dementia Adventure. A few words about us for those of you who haven't heard of us. We are a small Essex-based charity, although I'm not in Essex, and we've been running for 12 years now, and this is our mission. It's about enabling people living with dementia to get outdoors and connect with nature and their community and have a sense of adventure and choice in their lives, and to provide a bit more meaning and purpose. How do we do that? We work with some of the partners that we've listed below, and it is a mixture of training and support. But we also do supported holidays all over the country, and those are on hold at the moment, but we hope to restart those when we can. And we draw a lot on that experience from the holidays to guide us. Thanks, Debbie. What's really important, I think, is rather than me talk about the importance of nature right away, is to hear from someone living with dementia. And this is Chris. Chris and Jane live in North Wales, and he was diagnosed in his early 50s. He couldn't remember the tools to take to work anymore, and he's a real enthusiast of getting outdoors. So this is about the importance of nature in his own words to him.
I sometimes go out in the garden to sit down and have a few tears on my own. I'm not going to get disturbed. I'm not going to be embarrassed. And it's something I do now and again. And the other day I was doing it, I don't know if it's the day, maybe the other week, and a hedgehog came out. And immediately I was distracted from my anxiety, my stress, my depression. I didn't have dementia. I didn't have any problems at all. And that's what nature does for you. It distracts you. It's beautiful. It doesn't ask anything of you. It just displays itself. And it's there for our appreciation.
He was just in the moment, just him and this hedgehog just walking past. Just, was it 2 feet? Just 2 feet away from him.
Yeah. And it just got on with its life. And I just sat there and I watched him going backwards and forwards, and even the cat from across. And the cat was watching it as well. It's obviously had dealings with the hedgehog because he didn't go for it. But even the cat was watching as well. And I now go out and I look for these things now. And it's beautiful. There is no, you don't fail. You don't succeed. You just observe. And there's no pressure. There's no pressure. It's just there for you to appreciate and distract you. And you are normal again. You know, you're not that person with dementia. You don't have any problems at all. And I think that goes for anyone and everyone.
That's a really lovely story about the hedgehog from Chris. And you know, his words there, so powerful. It's nature's just there to appreciate and distract you. You're normal again. You're not that person with dementia. And that's something we hear time and again. Thanks, Debbie. So just a little look at this project that we've been involved in the last 3 years, which includes with Social Farms and Gardens. We ran something which was called Dementia Adventure in a Box. It was supported by the lottery fund, and its aim was to give people living with dementia the opportunity and support to access nature and the outdoors. And we worked with 4 partners, and you can see Social Farms and Gardens there. We worked in locations not quite UK wide, but down from Scotland right down to the tip of Cornwall with one care farm. I think it was Morwena. And we ended up doing over 3,000 experiences for people living with dementia over 44 sites. And as you can see, Social Farms and Gardens through, I think it was around six farms participated in this. And I have to say they were absolute champions of this project, because of all people, it seems like the care farmers are the most sort of adaptable and flexible in terms of their setting, thinking about ways to make things work. So we got some of the most lovely, experiences and write-ups from those situations. And what did we do? I mean, Gerry will probably tell you, but it was up to about 3 days of support in terms of we looked particularly with the care farmers. We looked at risk assessment, which I know you're familiar with, but it's different when we're thinking about people with dementia. How to design a program so that you can build the voice of people into what matters to them and what makes sense. We looked at that basic dementia awareness too, which is so important. If you're going to run a program, you need to have that knowledge. And we spent a lot of time looking at the importance of nature and that multi-sense experience, and trying to increase staff confidence around engagement. Thanks, Debbie. But rather than talk any more about it, I think this film, our time is short, and this film really captures quite nicely the project. And one thing to watch out for is you will see Scrubditch Care Farm in there, so some lovely pictures, and you will see Gerry, which is really nice because she's going to be talking about that in a minute.
Hi, I'm Paula. I work for Dementia Adventure, and for the last 2.5 years, I've been managing a project working across the country with organisations to help them get people who are living with dementia outside and enjoying and engaging with nature.
You can walk round the forest, and it's just open space. It's wonderful, and it's very uplifting.
You see other people relaxing and enjoying themselves when maybe they were worried at first, or maybe they've had a really rubbish morning up till then, or a rubbish week, and they come and they're just happy to see other people that will ask them how they are. They relax, they enjoy it, they see the animals, and by the time they sat down eating cake and drinking tea, everyone's having such a lovely time.
More often than not, they will present here and you can see there's a little bit of discomfort and there's a little bit of what am I doing here, where am I, why are the children running around, and what's with the teepees and the lights and things. But then it's almost tangible, this moment where there's a sense of ease and comfort.
Relax. Just wander about.
We all had a lovely time in the weekend. I haven't had a time that I've been here that I haven't enjoyed myself. It's lovely.
The training that we do with the organisations is to help people look at what some of the challenges might be if you are a person living with dementia.
Paula and I have been going round doing training to say how important it is to get people outside in the fresh air. They've learned so much from having a person with dementia present. I like people to ask the questions, and I'll answer honestly.
For me, the standout training was thinking differently about dementia. It's just an individual living with dementia. They will all be, expect always this, everybody's unique.
Get to my age and you're still doing things that you've never done before. I've never done anything like this before. It's very important for us that we can.
So whether it's raining or sunshine, it's a lovely couple of hours to look forward to every week.
If I'm feeling good when I live here, hopefully on a Tuesday they're all feeling good as well. It's very entertaining.
I think it's been great. I just regret I haven't been before. Yeah, I'd like to come again.
Bernard, I pick up every month, and for the past 3 months, he's stood at the door waiting for me, and he'll tip his head and say, "I remember you, Sarah," which is just, it's just amazing.
And it's been really good fun, going somewhere, doing something completely different.
It has been a real privilege, and it's been brilliant to be part of that journey with people and just be part of Dementia Adventure, making a difference to people and getting the message about being outdoors to more people.
Okay, great. Thanks, Debbie. And yeah, some lovely images of people out and about doing the thing, and what an experience might look like on a farm or in a green space for people, and what that feels like. Okay, so thanks, Debbie. Let's move on. So just a few slides here to look a bit more closely at the health and wellbeing benefits about getting outdoors and having that closer connection with nature. And there is research that shows that spending time in nature can slow down the progression of the disease. So yeah, and you know, there's a number of different ways that is. And you know, I'm going to pick up on that point that Chris made earlier on. You know, nature is a great distractor, and what it's doing is it's focusing that, you know, the brain in the most positive way, and it brings you into the present, sorry, and it's that's quite healing and soothing for the brain. It's not thinking about the past or the future. It's right in the present. And I was talking to a gentleman called Pete living with dementia, and he was saying to me, dementia is so exhausting. My brain is working 2 or 3 times harder than anybody else's in this room. I'm trying to follow a conversation, understand it, think, and then respond. And then he says, you know, and in a group, I'm trying to look at people's faces and think, am I behaving in the right way? What do I need to do now? So, you know, getting out in the outdoors is just so much easier, and I can just relax and just enjoy being in that place. And we hear that again and again. People say, when I'm outside, I leave my dementia behind. Thanks, Debbie. So this is a really interesting slide, and it shows a picture of the brain when it's quietly sitting, and then it shows that electrical connectivity in the brain after someone's been walking around for 20 minutes, and you can see quite a difference going on there. And you know, dementia causes neurons and connections to deteriorate. That's what's going on inside the brain, but some connections remain intact, and it's through being active and keeping that brain stimulated in different ways, not just movement, but also music and things, that keeps those connections working, and is good for people's well-being. So yes, the point is, it's not just about going for a 20-minute walk. It could be something to do, you know, it's just about getting those connections fired up. So of course, on a care farm where there's so much to do in so many different ways and tasks that will suit people, things people can do rather than things people can't do. You know, could use your whole body to do things, but equally, if someone's sitting down, there will be something that will suit someone and really help with that connection and stimulation. Thanks, Debbie. And a lovely summary slide here produced by Natural England, which looks at some of the benefits. And you know, I think things to pull out here is that balance of neurochemicals going on in the brain, you know, that reduction of cortisol, the increase of melatonin, that help with sleeping and eating patterns. People tell us that, and the research shows that again and again. But also it says social interaction there. And, you know, we hear again, and Gerry may give us a story about this, that people can be so very different once they get outside those 4 walls and outdoors. And you'd be surprised, the knowledge, the things people have to say, the way they're interacting. And that's a lovely thing if a carer or a loved one, family member is there, because, you know, they're experiencing something together, but in a very different way. And I've seen that for myself with some of the projects I've been running face-to-face too. And if you're interested in finding out more, again, we'll link you through to the resources you can see on the right-hand side in the screen. They're on our website and Natural England's, and we'll give you a lot closer look at this sort of thing. And the final thing to say on this is we're not talking about a huge amount of time to get those wellbeing benefits or that mood boost from being outdoors. It can be very small. So it doesn't need to be a day that's planned and long. It could be just, for somebody, it might be 5 minutes, it might be 15 minutes, and it can make all the difference. It's really down to that person and the individual. So quite small amounts of time to make a real difference. Thanks, Debbie. So I thought it was important to say a few words about the symptoms of dementia, because these are things on a care farm that you will need to think about in terms of your planning and your site. And there are over 200 different types of dementia. They're finding more all the time, and each comes with different symptoms, and not everyone will experience the same symptoms either. I've listed some of them there. I mean, there's a lot of focus around memory, but memory loss, but equally it's people's ability to focus and follow things, follow information. So thinking about processing information in the brain. And language we've talked about, whether you have language trying to get a response, or maybe you're no longer speaking. And then something that's not considered so much when you attend courses and things is how dementia affects the senses, and it does affect them quite a lot. And we've linked you here into a booklet to find out more about that, but I'd certainly encourage you. We have free courses about this running weekly, so if this is something you want to learn more about, please come and join us, and we'll post details at the end about that. But yes, it is important to think about the senses on the farm, and I'm just going to show you a few examples on the next slide. Thanks, Debbie. I mean, the main thing to think is not everyone is going to experience all the same, all these different symptoms of dementia, and it is absolutely down to the individual. And as you get to know someone, you'll get to see what if they do need a bit of extra support in one way. But it's that general awareness is important. So, thinking just about how the senses are affected, have a look at that black and white picture. Squint your eyes a bit at it, and I don't know about you, but it's sort of dancing in front of my eyes in not a very nice way. And this is what someone living with dementia posted of the tiles on their kitchen floor. And there's nothing wrong with that person's eyes, but it was how his brain was interpreting it. And he changed these tiles on his kitchen floor because it was affecting, he didn't want to go in there, it was affecting him subconsciously too. So colours and patterns can have an effect on some people. To the left of the slide, there's a picture of some shadows. And, again, for some people, not everyone, some people might see that or perceive it as black holes. The brain is telling them it's a black hole, and that's frightening. So shadows, black mats, that sort of thing. But again, not everyone. Your eye's ability to manage depth perception and contrast. So, in a positive way, we've got some brightly coloured plates here on a bright background, but you can imagine if you had white food on a white plate on a white table, how difficult it might be if you're not managing to judge distances very well. And the same goes to sitting down on something that is a bench but doesn't look like a bench. How could you judge where to put your hand if you're going to sit down? So these are all sorts of things that you need to things to think about. And again, simple things that help all of us is sort of for wayfinding. Contrast and colour on a gate or on steps as well can really make a difference. Just a taster there. We could spend all day talking about this sort of thing. Thanks. So next slide. One of the things we get asked a lot is what makes a dementia-friendly location. How do we make it dementia-friendly? And I don't really like that word, dementia-friendly. It is very labelling, but I think a better word would be inclusive. And this is a wonderful visitor centre near Aberystwyth, if any of you have been to it, and called the Red Kite Centre. And they wanted to invite more older people to experience all the wonderful things on offer there. So they went about all sorts of things. They did some training and staff awareness. They looked at information on their site, both and before you visit, and they looked at their facilities, just as a care farmer would. But then they came to Dementia Adventure and said, but we don't know how to reach people. And that's the key thing right from the start, really. It's that co-production element. And it can be as simple as just having an idea and then going to talk to your local support group. Go and have a cup of tea with them, take some pictures, maybe take some objects, and see where the conversation goes. Are people interested? What would matter to them if they were going to come to your care farm? What would they like to do? And just take it very gently in little steps from there. And that is a way forward. Thanks, Debbie. And as a care farm, if you are, sorry, thanks, Debbie, we'll move on, thanks. As a care farm, if you are going to be running an outdoors programme for people living with dementia, then you will need to do an audit. And I know you probably do audits all the time. So, but there is a slight difference here. And again, this is where that sort of training and learning comes in, is that you do need to focus a bit more around sensory sensitivity, which I've just been talking about, and how people process information in terms of what you're planning. And you know, people want information. What is the information that makes people feel safe and confident when they come and visit you? And Gerry might well talk about that. And, you know, there really is nothing better than to actually talk to people living with dementia and invite people over to your site if you're just starting out. So at the bottom of the picture, you can see a picture of Jimmy's farm, if you've heard of it, down in Suffolk. It's a wildlife and nature park. And 3 couples living with dementia were invited as a little focus group and a coordinator down to do a little audit of the site. And you'd be amazed with what people come up with. And sometimes it's just the simplest things, like, for instance, those toilets there. For any of us from a distance, you're not quite sure what's going on there and which door, but simply by changing the signing on it, you can make it much more enabling for people, so you don't need to ask, and that applies to all of us. So there's simple things you can do that are gains for everybody. Thanks, Debbie. There's a bit more to come. So there is some guidance that you can use to help you do this, and there's a wonderful organisation called DEEP, the Dementia Engagement Empowerment Project, that has fantastic guides for organisations and for people living with dementia on all sorts of things, from designing posters to how to go about a site audit. I really recommend having a look at that. And here is, on the left, there's a picture of a guide that helps you do an audit of your site with people living with dementia. And if you don't follow it thoroughly, that's fine too, but definitely look into it for the ideas, break it up into small portions. And also worth a look is that document on the right there, produced by Visit Britain. It's called the Dementia Friendly Tourism Guide, and it's quite new. And again, it was co-produced with people living with dementia, and it's a really nice look at, it's a free download, so you can put sort of checklists in there of things to consider. Thanks, Debbie. So really just my final slide. People ask us about, you know, activities. What are we going to do? What can we do on our farm? And I suppose I want to turn that around a bit and say, actually, it's less about the activity and the task focus. It is much more about that experience. It's about that multisensory and a more feelings, not fact-based experience. Again, find out what matters to people. If you are starting to draw up a programme, have a chat with people informally over a cup of tea and start to tease out what you might do. And I thought I'd just sort of use this slide to talk about connection with nature, because we hear a lot about this word connection, and there's been a lot of work done by the University of Derby. Again, we'll link you into that if you want to find out more. And it could be that someone has come to visit and they just simply want to be. You're not planning anything. They're just enjoying the experience of being somewhere different. Maybe they've found a lovely seat in a sunny place and they're watching somebody feeding the chickens, or even chatting to them, as you can see there. So they're just a very sort of enjoying in the moment there. And another level of connection with nature might be that sort of contact, and you can see, and that active, being a bit more active, and you can see the gentleman there absolutely absorbed in the moment there. You know, that real connection. He's certainly not thinking about anything else. He's absolutely right there. And you know, taking it a different level, again, it's all about the person and what suits them. We have a lovely lady here, and they were, you know, right from the start, they'd produced a bird feeder and they were looking for somewhere to hang it. And that's more of that sort of taking something through from the beginning to the end. But it's really about what makes sense, what's meaningful for that person that's there. Thanks, Debbie. So I'm going to stop now. We would love to do more with social farms and gardens around this, and with care farmers out there. For the moment, though, if any of you are, you know, have volunteers that are looking to train up, particularly while we're all not able to get out, then we are running this Thinking Differently About Dementia course that was mentioned in the film, and that Gerry's also done. It's a 2-hour course, and we're running them for free weekly. This is all something we're able to do through grant funding. And then after that, we run these more specialist topics. You can see there, time in nature, which are an hour and a half. And again, if this is something that interests you to take a closer look at, then sign up on our website. I'll just leave you with the words from Wendy, and I hope that's come across through this little bit, that if you get it right for people with dementia, you do get it right for so many other groups of people. And I'm sure as care farmers, that absolutely resonates with you. Thank you.
Brilliant. Thank you, Kath. That's absolutely fascinating. I'm bursting with questions, but I'll hold them in. Just before I hand it over to Gerry, I just wanted to say to the audience, just keep an eye on the chat function, because I can see that Katie's been beavering away, putting a lot of sort of links in to the things that Kath's been talking about. So just keep an eye on that, because there's a lot of information there. So I'm going to hand over to Gerry now to talk in detail about her experiences at Scrubditch.
Thanks very much, Debbie. Hi, everybody. Well, as Kath said, I could talk for a long time about our experiences and what we've learned, but I will try and give a decent overview of who we are, what we do, and maybe some of the issues that we've come across whilst doing it. And then, yeah, if you have any questions, I'd be happy to answer them. At Scrubditch Care Farm, we're based near Cirencester in Gloucestershire, and we started up in 2010 as a not-for-profit organisation and became a registered charity 3 years later in 2013. We primarily provide a day service for adults with learning difficulties. 3 days a week, we have adult students who come for a 5-hour day, and they work on the care farm, caring for the animals, growing produce, woodwork, site maintenance, all sorts of things. You know, very seasonal work, as on most care farms. It varies just depending on the weather and what's happening at the time. We also do special days for children from special needs schools. We have support groups that visit, and we have individual one-to-one type sessions for children with additional needs. And we've done inclusive children's activities in the school holidays for disabled and non-disabled children. But we wanted to run something for people living with dementia. Sadly, one of our volunteers was diagnosed with dementia and became quite unwell, but he really continued to enjoy his time on the farm, and we realised how valuable it was to him being outside and spending time in nature and with the animals and things. So we were unsure where to go, but then up popped Dementia Adventure with this great project that we could get involved with. So thanks, Debbie. We were able to, in early 2018, we were able to get involved with them, which we started the training program, some fantastic training. I can't recommend it enough. If you can do the online training, do, because we didn't have any real experience of how to support people living with dementia. We just had our very personal experience of knowing somebody who had been diagnosed. We needed to think about the risk assessments and everything like that, about how to provide activities that were suitable and make sure our facilities were appropriate. So it was really good to have all the training. We chose to run our sessions for people living with dementia and their carers to come along together and spend time on the care farm. Thanks, Debbie. I think we're on to the next one. Lovely. This is a flyer that we produced. We found it was very important to make sure, as Kath mentioned earlier, we get the right information to people to help them to feel comfortable about coming along. So we tried to include photos, information about what would happen when they were there, and then contact details. We attempt to have a phone conversation with everybody before they come, just to really put them at ease and make sure they know what's going to happen, who they're going to meet, how long it's going to last, what they need to wear, what it will be like, and really, you know, put them as much at ease as possible, because so many people worry that it's not for them, and until they come, they can't know that. So we want them to come and try. So by running it for people with living with dementia and their carers, we were able to grant fund the sessions and provide more spaces, because we weren't having to provide one-to-one support for each individual that came. That meant we could also make it free for people to attend, which we felt was very important. Thanks, Debbie. And we found very quickly that everybody benefited from coming along, the carers as well. We've got a regular group of, I think Kath mentioned earlier, around 12 to 16 people, but it fluctuates. And they do all sorts of things when they come, again, seasonal and weather dependent. Lots of playing with chickens, as you can see. And you've seen some of our chickens already in previous photos. The lovely thing about chickens, as I'm sure everybody knows that keeps them, is that you can get hands-on with them. You can have contact with them, whether they're chicks or older hens. There's the lovely experience of collecting the eggs, of feeding them, whether it's they're feeding from your hand or scattering the corn. And lots of people we found have kept chickens in the past or know somebody who's kept chickens. So it's been a real conversation starter, a real distraction, like the hedgehog. You know, chickens are a great distraction. You can watch them for hours. So yeah, no, they're really good. All the animals are lovely, but chickens we find are a real hit with people. Sorry, I'm just losing myself. I'll go on to the next slide, please, Debbie. The sheep are a good one as well. We could go through all the animals. I won't do them all in detail. They enjoy the sheep because we can work together as a team. And again, it's doing something that's meaningful and giving everyone a sense of purpose because we're all helping. So we round them all up together, get them in a pen, and then either, you know, check them over, trim their feet, worm them, whatever needs to go on, or just look at them really, because it's just so nice to be up close and personal. And again, in our part of the country, we have a lot of people that visit us that have grown up in villages or on farms, and it reminds them so much of their childhood or of somebody they knew. So we have some lovely conversations around it, the things that, and then equally there are some people that don't want to chat but just have such a lovely time being close to the animals, which is really nice to see. Thank you. We were very conscious that not everybody could make it around the farm in the same way. As we discussed earlier, you know, surfaces can be uneven and really off-putting to people. So we make sure that some people, if they are able, can go off for a walk up to the woods and feed our pigs. But others maybe will just go for a short walk across a flat surface and see some closer animals to them, or do a task sitting down. We do take chairs with us. You may have noticed on the video I was carrying a plastic chair with me. I quite often to be found carrying a plastic chair because it just means that wherever we go, somebody can sit down if they need to. We have also invested and had some grants to fund some nice new benches. So good benches with nice armrests that look like benches. We've got placed around the farm so that people are able to sit when needed, and you know, it's easily recognisable for them and comfortable. We try and always take animals to people. You can see there all our animals that we can take to people. We can take ducks, we can take horses, we can take dogs, and we can take sheep. We also take piglets. So it just means that everyone gets the hands-on experience, even if they're not able to get to the animals, which I'm sure everyone's come across in care farming, because that doesn't just apply to people living with dementia, but it is something that's really worth considering, what you can provide to somebody who can't get around very well. Thanks, Debbie. And there are the piglets. Everybody loves piglets, don't they? It just, you know, you can see the happiness on people's faces when they get to cuddle a piglet. It's just lovely. And so many of our attendees take photos to send to their family and to share with, you know, their friends. It's really nice because you know that it's not just us providing the care farm experience. It's a real big part of their lives that they share with other people, which is really nice. We found that quite a few people that attend have run out of things to do. That, as Kath mentioned, there are lots of indoor activities. There aren't many outdoor activities for people living with dementia, or places you can visit. They're quite often confusing, they're big, they're busy. So what we've aimed to provide, and I think we've achieved it, is a friendly, welcoming, safe environment where people can be themselves, not worry about what they're saying or what they're doing, and have a lovely time. We found that we've had attendees who have brought their family along on a, you know, if they've had family coming to stay, family from Australia have come to visit. We've had, you know, son and daughter-in-laws that have come to stay for the week and they've come to visit. So it just means that they're sharing it with their friends and family, which is lovely. And it's a big part of their lives. We've also found they attend our other events. We have quiz nights and Christmas fairs, and they like to come along and support those because they feel part of a community by coming to us regularly. Thanks, Debbie. Another thing we do a lot of is growing vegetables. I'm sure lots of you are familiar with that. We grow them and we try and sell them, which doesn't make us an awful lot of money, but it makes us a little bit of money. And a lot of people have had to downsize and maybe don't have a nice garden that they can grow vegetables in. So we found it's an activity that they really enjoy, getting stuck into a good bit of gardening, and quite often have way more knowledge on it than me, which is really handy because I'm very much just chucking the seeds and see what happens. So no, we've had some lovely times gardening with them and growing produce. But they also then often like to buy the produce, which is really nice, and take it home, and so the experience continues when they get home. They buy eggs, they buy our meat, they buy our vegetables, which is lovely. And speaking of selling things, it leads me on to the important thing, which is fundraising and how to fund these things. Those are the last of my pictures, but I've just got a few more bits to say about the nitty-gritty of running our sessions, really. So fundraising, because we run the sessions for free, what we did was we apply for grants which cover our costs, our staffing, our refreshments and what have you, and we've had, I think, eight grants over the last nearly 3 years, which have totaled just over £11,500, which has covered all our costs, which means that people can come for free, which I feel is such an important thing, as it's just one less thing to worry about. There are other things to worry about, like how to get there. Transport is often an issue for people getting to care farms generally. Because we have people coming with their carers, so whether it's their children or their partners, we don't tend to have an issue with people having transport, and we've got a really good local taxi company who comes to us. So, but I do realise for other people transport is an issue. The other thing that has been really good for us is making contact with other organisations to help raise awareness of our sessions. So we've got a great relationship with our local Alzheimer's Society Dementia Advisor. She's a very nice lady who goes and visits all these people who have recently had a diagnosis, and she signposts them to us if it's something they seem interested in, which is really nice because it means that the word is getting round without, directly to people. And I think people feel more confident if they're getting word of mouth, direct recommendation. We also advertise online, local press, village newsletters. We contact all the local GPs regularly, hopefully through social prescribing we get people to us, although it's quite tricky to know how that works in each different area, but it's really just about spreading the word as much as possible. And I think that covers most things. I did have a couple of tips that I just jotted down before that I will just say. Kath mentioned speaking to people about what they want and what they would like. We held a couple of open mornings before we started our sessions, and had some visitors of people living with dementia and their carers come out and just tell us what they'd like to do, so that helped. Making local contacts is really important to try and we visit our local specialist dementia care home sometimes. We take some chickens, so we go and see the people that can't get out to us as well, which is really nice because they just haven't got the means to transport people out to us. And yeah, just word of mouth. I think building relationships with people is so important, because the more recommendations you can get, the easier it is to speak to more people and spread the word. I hope that covers everything people want to know, but happy to answer questions.
I'm sure there's lots of questions. I think actually I'm just going to move on because there's quite a nice couple of slides here. I don't know whether they've come from you, Gerry, or from Kath, just over the sort of personal experiences from people. Is that from you, Kath? Do you just want to run through those couple of slides at the end?
It was, but I think it could well be from Scrubditch, actually. So really, this slide, if we've got time for this, Debbie, yeah.
We'll
okay.
just go through it very quickly, yeah, and then we'll move on. I'm sure we've got lots of questions, actually, so go on, Kath.
So, I mean, the point about this is the impact on people's lives. And, when you get a statement like this, it's been a godsend. I swear blind, I don't think I've got Alzheimer's anymore. I seem to remember things that I didn't before, and I wasn't doing so much. And I think a comment like that just shows what an impact it's having on someone for their well-being and their confidence as well. Thanks.
And then there's another one here.
And then the next one really is, there's a slight lag, isn't there? No worries at all.
Yes, sorry, that's what's been confusing you both. I can see that, yeah.
Yeah. Not to forget that carer or family member, the husband, the wife, the daughter, the son. It can be so isolating, and particularly now as a carer, and you forget you don't have those normal social interactions. You're only in a medical centre or you're at an appointment, so it's like I'd forgotten how to chat. How fantastic is it?
No, yeah. Absolutely. It's two really, really lovely comments, I think, for you to share. So Thank you both very much. I mean, it's been absolutely fascinating listening to you both talk. I mean, I've got said loads of things sort of running through my mind. I'm not going to hog the limelight, though. I'm sure I'm going to let Katie switch her camera back on, so she can pick up on some of these questions. I think for me, it's been really uplifting, I guess, to know when I've been sort of involved in care farming in some capacity in this country for the last sort of 20 years. And certainly when I first started out and was visiting farms and talking to them, there really wasn't any of this sort of work going on in this country. It took a visit to Holland for me to see how they were working over there. And we just seemed really a bit sort of lagging behind, actually. But I think this sort of work and so many of the farms now are starting to support people with dementia. It's just really uplifting to hear about. So thank you both very much. Katie, over to you. Do you want to pick up on some of the questions that have come in?
Yes, so we've received a question from Jeff Stevens. Thanks, Jeff. So Jeff has asked, is there much research into running mixed groups? For example, we used to have one day each week for people living with dementia, but now we encourage groups which involve people living with mental ill health and learning difficulties with those living with dementia.
Kath, do you want to pick up on that?
Well, I'd just like to respond. Hello, Jeff. You were involved with the project too, so it's really lovely to have you here today. I think we're just talking about people, aren't we? People's interests and needs, and just being part of something. So that's all I really want to say in response to that. It's what works for people, and you know, leaving that diagnosis behind. Gerry, did you want to add anything to that?
No, I think that probably covers it. I mean, for us, we run quite different sessions for our adults with learning disabilities, quite full-on working sessions, which is why we decided to make it separate for our people living with dementia, because as a demographic, they just tend to be a bit older and want to take it a bit slower. But we have had crossovers and of, you know, just passing it on site and stopping for chats. And we've had children there. Children are lovely to have around our folk living with dementia. They get on very nicely and all have a lovely time together. So yeah, no, it sounds like a wonderful idea to me, if possible.
Lovely. We've got another question from Caitlin Howells, who has asked, what is a good session length, do you find, and what time of day, and weekly or monthly?
I guess that's for me.
Yes, yeah.
So initially we thought, because you know we were starting from scratch, we would run fortnightly. It soon became apparent that people prefer to do something really regular, because then it feels familiar. You're less likely to forget about it. It grows on you and it fits in a routine. So, and it was very easy to do, I have to say. So we went weekly. We run a 3-hour session, but people can come for as long as they want, because for some people half an hour is plenty, and for some people they want to stay a full 3 hours. We don't start too early in the morning. We start at 11, which gives everyone a chance to, you know, get up and get organised and travel. So we go 11 through till 2 if they want to stay till 2, and they can bring some lunch.
Right. Kath, is that typical of a lot of the other farms? Do you know, Kath? Is that sort of fairly typical? What Gerry said.
Well, you know, as I say, this whole thing about talking to people from the start, you know, ask people what time do they think they can get organised enough to be there, and you'll generally find it is somewhere around that 10:30 to 11 o'clock mark. People want to be away before the schools get out. But having said that, never say never again. You know, you might meet some people who just want to do it differently at a different time of the day. And I just wanted to go back to Jeff's comment then about different, you know, people with different support needs and things. I think it is down to the individual and what makes them feel safe and comfortable. For some people, it absolutely might be in a wider group, but for other people, you hear a lot of I just want to be myself among people that understand. So it's sort of overcoming people's worries about that. And if you can do that, and then these are the things you need to consider around how you plan a group.
Right. No, thanks, Kath. That's really useful. Katie, do you want to pick up one of the next questions?
Yep, so the next one is from Karen Palmloff, who has asked, are you also in contact with care homes or are care farms for people with dementia that are still living at home?
Sorry, is that me?
Yes, I guess it probably would be Gerry. Yeah, do you want to pick up that one?
So we do have some contact with care homes for who have people living with dementia there, and it's tricky because we actually had a visit set up for last March, which hasn't happened because it got put back and it still can't happen, from a care home that was going to bring a minibus of people, but I think the issue is often that people who live in the homes vary so much in what they want or what they're able to do that we don't get groups come from them. There is one local to us that we visit, and that works really nicely. Because people can dip in and out and go off to their rooms and things without being taken out for a long period of time. I think it's nice if you can build a relationship with a care home.
Yeah, certainly with this project, with the DA in a Box project, one of the partners was the Methodist Homes Association, and one of the legacies coming out of that is we've now running a national project with them around, and particularly with their activity coordinators and care staff, around how to build more of those green or nature experiences into their care home and what that might look like. So yeah, we're doing a lot at the moment, and that was just a really nice thing coming out of MHA's involvement in this project. There is an awful lot, there's an awful lot of projects and skills and experience out there which we're happy to match people up with if you've got, if you want to contact us directly.
Great, thanks. Katie, there's a question I think from Fiona that's quite interesting actually. Do you want to pick up that one?
Yeah, so Fiona has asked, our community farm is very small and open to the public. It's a free resource, so it gets quite busy and full of children, especially in summer. Do you have any advice on how to still offer activities to dementia patients when people are still on the farm visiting?
I think this is quite an interesting question actually, because we just, as a sort of organisation, this is something which we get asked about, and it's a shame actually I haven't got Jeff on the panel as well, because I know Jeff from Pathways has sort of has done some thinking around this as well. So Gerry, is this something I'm not sure at Scrubditch, are you a sort of open farm or not? Can people visit now?
No, we are closed because some of quite a lot of our people who attend are very vulnerable and can't just take trips out into the public. So we're a closed farm, people by appointment only. We have had days which are busier. We've had volunteering groups and things in when our group of people living with dementia are with us. They're quite well established, our group, because they come weekly and most of them been coming for a while. So they're very familiar with the farm and it doesn't faze them too much to see extra people around. I think, if it were me, it's difficult not knowing the setup, but if it were me, if there was somewhere that could be kept quiet so that you could be based there within the site, that would work well, because then you could have your quiet area where you were with your group of people, and then you could dip in and out and go and look at things or get involved with things, but be able to back away from the public maybe. It could be overwhelming, but again, like Kath said, you've got to talk to people, because some people might not find it too overwhelming. It might be okay.
Yeah, Kath, have you got anything to add to that?
Well, I just think really wise words from Gerry there, but certainly summer holidays, busy times is something we'd always say think about in your planning. And Gerry's made suggestions about quieter areas, because it goes back to that sensory sensitivity, that communication, that sort of possible overload about it being busy and noisy. But again, it's about looking about what you can do is absolutely, as Gerry said, are there times or ways that you can still provide the experience that makes people still feel safe and comfortable, and everyone is different.
Yeah, great. And I think, as I say, it's something we've been sort of asked about before, and it may be something to perhaps pick up at a sort of future date to discuss further with some of the farms. Katie, is there another question you want to pick up?
Yeah, so Fiona has also asked, how many staff do you have working with a group?
Right, so just touching back on what I said about being able to provide it for free as well. One thing I didn't mention is that occasionally we are asked if we provide respite. So somebody wants to drop off their cared for person living with dementia and leave them with us. We decided quite early on that that wasn't something we were going to do, mainly because it would have involved changing the way we run the sessions. We would have had to have more staff so we could provide one-to-one support, and we would have had to charge, there would have had to be a charge for it because we couldn't grant fund that. So the reason we get these grants is because we can then host a large group with a lesser number of staff. So we have 2 members of staff on each week for the 3-hour sessions, but we do also have a few volunteers. The volunteers are not specifically skilled or overly trained people. They have some in-house training on how we run our sessions and how to support people living with dementia, but they're actually people that have been socially prescribed to come and spend time with us, which is really nice because it means that we're benefiting them as well as the people attending the sessions. But we actually only have 2, occasionally 3. It depends what the activities are that we're doing. If we have to do something that needs a lot of skilled people, maybe doing something to the sheep, then we have an extra member of staff on that day. So we have 2 or 3 members of paid staff to run a session.
Great. Kath?
Yeah, one project I have been very hands-on involved with in getting off the ground was a project up at Rutland Water with Leicestershire and Rutland Wildlife Trust, who have a visitor centre there. And one of the wonderful things about that was they have a volunteer base, but the volunteers were really interested in this project. Somehow it really appealed. We were going into the woods and doing fire pits and toasting marshmallows, all that lovely sort of forest craft, forest school stuff, as well as using the bird hides. And we had a high number of volunteers, which allowed us, even with carers, family members coming along, to almost go one-to-one. In fact, we had too many, dare I say. I know that's not a normal thing to happen, but it just shows if you've got something that appeals to people, we can also appeal to different volunteers that you might not normally get on a care farm, who absolutely think this is something I can do. So it might open up new volunteer opportunities for you as as a care farm too.
If I could just add, sorry, we also found with our group, because we've got some people that have coming for a couple of years now very regularly, the group itself, it's such a community, it almost doesn't run itself, but they help to run it. They're such a part of it that when it comes to making the tea, they go off and make the tea before I can get to the kettle, and they know where the animal food is kept, and we all work together to do all the jobs. So once you've got an established group, it's not the staffing is really about risk assessments and making sure the animals are in the right places, and that's and health and safety and that side of thing. It's not necessarily about having lots of people for the attendees, because once they feel comfortable and well established, it's their place too.
Fantastic. I'm just a bit conscious of time now, Katie. Have we got any further questions? I can see there's a few comments, so we're just going to pick up on.
Yeah, so Jeff has very kindly provided some insight from Pathways. So with the staffing ratios question, Jeff has added that staffing ratios really depend on the ability of each individual, but as they don't usually have carers and attendants, they nearly always have one-to-one support for their farm workers. So that's partly because they do actual work often rather than just the social aspect, although the social aspect is vital. With regard to the having visitors on site, Jeff has put, safeguarding is the key thing. Much of our work will be invitation or referral only, but he agrees with Gerry, if you can have the public in specific areas and farm workers having their own space, that may be the best solution.
Yeah. No, absolutely. I thought to say that Jeff might have something to say on that, so that's really quite useful. And I think this whole topic's been really interesting, and I suspect there'd be some appetite to do a bit of a sort of Q&A session, actually, in a bit more detail, possibly with some of the other farms that have gone through this, like Scrubditch have, actually, some of the other care farms that have been involved in this work. So could be, again, something to think about further down the road. But for now, I'm a little bit conscious of time, so I just want to say thank you very, very much to both Gerry and Kath. and to everybody who's attended. We hope you found it really useful. As I mentioned before, there's been plenty of sort of links put in the chat function, but we'll make sure that we sort of circulate any of those and any further information around, make them available on our web pages as well afterwards. And I'm pretty sure that both Gerry and Kath will be happy for you to contact them. Just really now to say that after this webinar, you will receive an automated email with a link to a short feedback survey. If you have got time, we'd be really grateful if you could complete that, because it does just help us keep track of who's accessing the resources and provides us opportunities to learn and adapt resources as we're going forward. We're very receptive to sort of ideas on these webinars from you, from our audience. So please do let us know if you've got any ideas of things you'd like us to run in the future, because we do really like to hear from you. We will get on to getting the recording of this webinar uploaded onto our website very soon, and you'll get a link to that. But please do feel free to contact any of us for further information or support. I think the contact information is there on that final slide. And again, please do follow us on Twitter. We're very hot on Twitter. We like Twitter and we keep in touch with people that way. So please do tag us on any social media posts that you want us to share. So I think that's it for today. Thank you all so much. It's been really absolutely fascinating. And we look forward to having you join us all again. Thanks, Kath and Gerry. Bye-bye.
Thank you. Bye-bye.